17 Indicators of Fatty Liver. How to identify the initial and advanced symptoms of hepatic steatosis, a silent threat. Is fatty liver risky? What do you experience when you have fatty liver? What are the 17 warning indicators of hepatic steatosis signaling that the fat in the liver is already worrisome? And what steps can you take to eliminate this fat before it's too late? Today, I will discuss fatty liver, a condition that is quickly increasing worldwide. In the 90s, hepatic steatosis was uncommon. Today, it is more common than you think and is even affecting children. In the United States, over 30% of adults over 35 have it. And don't think it's a benign disease. If you don't treat it on time, your liver can become scarred, develop cirrhosis, and even cancer. Just so you understand the scale of the issue, steatosis is one of the leading causes of liver transplants globally. You're not going to overlook it, right? It needs to be detected on time because the liver is an organ that can fully regenerate itself, up to a certain point. Knowing the signs and symptoms, you can prevent the disease from progressing, worsening, and you can even reverse it, leaving your liver clean. But I won't talk just about the signs and symptoms. I'll talk about a food that is the main cause of this fat in the liver. Let's go. What are the 17 symptoms of fatty liver that you cannot ignore? I will talk about 6 initial symptoms and 11 more serious complications that indicate liver problems, highlighting the urgent need for care. But first, I have to tell you something extremely important. This information is crucial to understand your liver health and act quickly. Let's go. What are the 17 symptoms of fatty liver that you cannot ignore? I will talk about 6 initial symptoms and 11 more serious complications that indicate liver problems. First initial symptom, fatigue. The liver, an essential organ, performs crucial functions such as metabolizing nutrients and generating energy. However, fat in this organ can seriously compromise these functions. Moreover, steatohepatitis, a condition where liver inflammation occurs along with the accumulation of fat, can intensify the feeling of tiredness. This liver dysfunction also affects hormone production, directly impacting mood, sleep, and overall body energy, leading to a persistent state of fatigue. Second initial symptom, stomach pain and heartburn. A study from UFMG revealed that people with hepatic steatosis often experience dyspeptic symptoms like heartburn, burning that extends from the chest to the throat, belching, and feeling of a full stomach, more than individuals without this condition, with a significant difference of 25% against 12.4%. Third initial symptom, excess gas. People with hepatic steatosis often have an excessive accumulation of gases. Radiologists note that the presence of fat in the liver can lead to this problem, which even hinders the visualization of the pancreas in exams. This excess gas is probably caused by changes in the intestinal flora, directly impacting liver health. Fourth initial symptom, pain on the right side of the abdomen, near the ribs. It's a discomfort in the upper right quadrant, or a light weight where the liver is located. A nagging pain under the rib, probably because the liver has grown in size, which can also press the phrenic nerve, causing pain around the right shoulder. Fifth initial symptom, loss of appetite. Loss of appetite in people with fatty liver can result from metabolic changes, liver inflammation, hormonal imbalance, symptoms like nausea, abdominal discomfort, and psychological impacts. These factors, linked to the impaired functioning of the liver, affect the regulation of hunger and the feeling of well-being, emphasizing the need for medical follow-up for proper treatment and management of this condition. Sixth initial symptom, nausea. Nausea in cases of fatty liver or hepatic steatosis arises for various reasons linked to impaired liver function. Firstly, the liver's ability to filter toxins is reduced, leading to the accumulation of these substances in the blood, causing nausea. Now, what are the 11 late symptoms of fatty liver that you cannot ignore? First, late symptom. Itching all over the body. In cases where liver disease is in an advanced stage and the liver is affected, there is an accumulation of bile salts in the blood. These salts can deposit on the skin, resulting in intense itching. This itching is more common on the palms of the hands, but can spread all over the body, causing discomfort. Second, late symptom, jaundice. Jaundice occurs due to the accumulation of bilirubin, a yellow pigment produced by the breakdown of red blood cells. Normally, the liver processes bilirubin, but if there is liver dysfunction, biliary obstruction, or an increase in the destruction of red blood cells, bilirubin accumulates, tinting the skin and eyes yellow. It's an important sign of various medical conditions. Third, late symptom, pale stools. In hepatic steatosis, the liver doesn't properly process bile salts, essential for coloring the stools. Without them, stools lose their characteristic color, becoming paler. This reflects the liver's difficulty in performing its normal functions. Fourth, late symptom, dark urine. In hepatic steatosis, urine darkens because the affected liver releases more bilirubin into the bloodstream. This bilirubin is filtered by the kidneys and excreted in the urine, increasing its concentration and giving it a darker color, similar to cola. Fifth, late symptom, red spots all over the body. When the liver fails to produce essential proteins for blood clotting, there can be a decrease in platelets, known as thrombocytopenia, and problems in the absorption of fat-soluble vitamins. This failure includes vitamin K deficiency, vital for clotting. As a result, it's common for red spots to appear on the skin, a warning sign for these hepatic problems related to clotting and the absorption of essential nutrients. Sixth, late symptom, spider veins. When the body faces a hormonal imbalance, there can be an increase in estrogen, which is not adequately processed. This excess estrogen leads to the expansion of blood vessels, indicating a problem in the hormonal balance affecting blood circulation. Seventh, late symptom, gynecomastia. And speaking of that hormonal imbalance, gynecomastia, characterized by the enlargement of breast tissue in men, can be an indirect consequence of hepatic steatosis, a condition where there is excessive accumulation of fat in the liver. This accumulation can interfere with hormonal balance, especially the relationship between estrogen and testosterone, leading to the development of feminine characteristics like gynecomastia. Eighth, late symptom, palmar erythema. Palmar erythema occurs due to the dilation of blood vessels in the palm of the hands. This characteristic redness can be a reflection of various conditions, including hormonal changes or liver problems, like hepatic steatosis. In the context of liver diseases, the damaged liver may not properly metabolize hormones, leading to a hormonal imbalance that causes the dilation of blood vessels. Ninth, late symptom, night blindness. Night blindness, or nyctalopia, can occur due to liver problems, due to poor absorption of vitamin A, essential for eye health. The liver plays a crucial role in storing and metabolizing vitamin A. In conditions of liver disease, such as cirrhosis or hepatic steatosis, the liver's ability to store and release vitamin A is compromised. This leads to a deficiency of this vitamin, which is vital for the production of pigments in the retina, necessary for vision in low-light conditions. Without adequate amounts of vitamin A, the ability to see in dark environments is significantly reduced, resulting in night blindness. 10th, late symptom, white nails. White nails, also known as leukonychia, can be a sign of liver problems like cirrhosis or hepatitis. This change in nail coloration occurs due to changes in blood composition and circulation, often associated with liver diseases. The sick liver may not be able to process and efficiently eliminate toxins from the body. This accumulation of toxins can affect various systems, including the blood circulation under the nails. Additionally, liver problems can lead to nutritional deficiencies, such as a lack of proteins and vitamins, which are essential for nail health, resulting in pale or white nails. This happens when most of the nails of the hand or foot appear white and somewhat dull. Almost the entire nail looks faded, except for a thin brown or pink band at the tip. Usually it appears on several nails. 11th, late symptom, swelling in the legs and ankles. Swelling in the legs and ankles, in cases of liver diseases, like cirrhosis, occurs due to an imbalance in the production and release of proteins by the affected liver.